Theodora Scrotto. I'm Executive Director with Environmental Health Trust, and we're working on this issue nationally and internationally. I think, speaking of millennials that were discussed, millennials are entirely unaware that the technology they love could harm their future ability to have children, could damage their memory, and could cause brain cancer. Contrary to assumptions that the radiation is low, be aware that industry has stated publicly in presentations that the radiation increases into communities from a fully deployed 5G network would exceed several countries' current radiation limits. The U.S. has among the highest allowable limits in the world. Why? Because, as was stated 22 years ago, the EPA was actually defunded from researching and setting proper safety standards that protect us from biological effects, and instead adopted radiation limits by industry-filled groups based on outdated science. And as a recent Harvard investigation documents, our agencies are captured at the highest levels, with a revolving door between FCC leadership and wireless executives. Our regulatory system is broken, and that is why governments need to act at every level of government, not just with addressing the FCC. Cellular radiation is a new, rapidly increasing form of environmental pollution, and numerous peer-reviewed studies have shown effects from low levels, quote unquote, of this radiation, which are below FCC limits. The CDC just released findings of increased rates of brain, liver, and thyroid cancer among those under 20 in the United States. And replicated research has shown that this radiation can promote cancer growth when in combination with other toxic exposures. Hundreds of scientists have issued an appeal for urgent action to halt 5G because of this science showing effects below government limits. I just want to point out, as was stated earlier about the firefighters, there was neurological damage shown.
International Association of Firefighters disagrees. They began opposing cell towers on fire stations after firefighters complained of health problems.
These firefighters developed symptoms.
Dr. Gunnar Heuser conducted a pilot study on firefighters at a station with cell towers.
And the symptoms included problem with memory, problem with intermittent confusion, problem with weakness.
Heuser says their brain scans suggest even low-level RF can cause cell damage, and he worries about more vulnerable groups like kids.
So we found abnormal brain function in all of the firefighters we examined.
So, following lobbying by firefighters, Cork and his co-author exempted fire stations from their bill, making them one place cell companies couldn't put a tower.
This is the first piece of legislation that I think anyone's aware of where somebody got an exemption because they were concerned about health. Did they tell you at all about the study?
All I know is that when the firefighters ask, I do what they ask me to do.
Because they're strong lobbyists?
Yes.
So if, say, school teachers and parents had a strong lobby and they asked you to pass something that would prevent these from going up in your schools, would you do that?
If I couldn't get the votes any other way.
Firefighter and cancer survivor Tony Stefani notes,
it's not only firefighters, it's the people that live in the general vicinity of these towers.
Current regulations don't take into account continuous low-level exposure from these small cells 24 hours a day.
More of these studies have to be done.
There are 230 scientists from 41 countries who have apparently reviewed more than 2,000 peer-reviewed studies, and they're calling on the World Health Organization to do more studies.
This issue cannot be put aside as go to the FCC. We need to take action now to protect communities. I also want to add that the public needs to be informed, because when they know, they will demand safe technology. And I would ask the council to develop new protective zoning and to a campaign to increase awareness among the public. You can do this. Thank you.
Thank you.